Hello, everyone. This is Dr. Famuyiwa, and today's topic that we're going to talk about involves donor IVF. So, I've had patients ask me, Dr. Famuyiwa, what are the steps involved? What do I need to do? I've just been told I need donor IVF to conceive. So, the first thing I always talk about is first define who needs donor IVF. If for some reason someone is unfortunate, they don't make any more eggs of their own, they can't make any eggs, or they have run into an entity where we call premature ovarian insufficiency, but they simply just run out of eggs at a very early age. Those individuals may be candidate for a donor IVF cycle. In addition, some patients who are older, for example, life happens and they get to 44, 45, and they cannot produce viable eggs on their own. So those would be candidates for donor IVF cycle. I think that most patients who are first told that they need donor egg, there is a feeling of being overwhelmed and over uncertain. There's an initial shock that, oh my gosh, I don't have any more eggs, or the eggs you have are not viable. I think the first thing to do is to just take a deep, calming breath, understand you're not alone. It's a very shocking news. And we do guide our patients to seek counseling if that's the case. Or for whatever reason, they may not be able to genetically produce eggs. Um, so I think you should first realize that um, it calls for a pivot. It's not a failure of your body, right? So we have to be careful of what we tell ourselves. I'll give you an example. I had a patient, let me call her Nara, that's not her real name, who now has twins. I remember the first time I met her, she was devastated, but she swung back. I think she and her husband had already probably had the talk about what they would do, their plan B, which I usually encourage patients to talk about. And she said, Dr. Camillo, let's go. If that's what you think is the path, let's move forward. And she did not waste any time at all. She just pivoted and we went with donor IVF and she conceived successfully. And I think her twins are now probably 25 years old. I've had other patients where you know that that's the downstream of what they need, but they're just in so much shock. They don't want to take those steps. Or I've had patients, for instance, from certain countries, East Africa, where religiously and culturally they said that was not an avenue that is available for them. And the diagnosis was very devastating. So what we could do is reach out with counseling services, advise them to seek out guidance from their religious leaders, because it's a very hard diagnosis for some patients. So let's talk about what are the steps. So you've decided you need to do donor IVF. What's the step? The initial part is you need to engage with your doctor in a deep consultation. It's not a quick run and go. We also encourage our patients to seek counseling for themselves so they can sort out their emotions. And we do have available um, um, therapists and counselors, psychologists that we work with that we can refer you to have this conversation because it's hard for everybody. Everybody needs to digest this information on their own. Once you've decided forward, then you might want to say, well, how do I even select a donor? There are several options. I have had patients who've had family members and they've had sisters and said they want to keep the genetic material in the family, and we have successfully done that using sisters or cousins of our patients, the woman, not the husband's sister. Um, you can also use an egg bank, as an anonymous donor. You could use fresh donor synchronized with either the clinic or the agency. So in that case, you're not using frozen eggs, but your body is prepared um, in sync with the process the donor is going through. And then, of course, you want to go through the donors' profiles. You want to look at their pictures. Oftentimes, you get to see their baby pictures. You want to look at their history, medical history, personal history. Um, and people do look at characteristics. They may say, you know what, I want someone who looks phenotypically like me. Or I had a patient whose mother came in and said, wow, this donor's picture looks just like your grandma. That's who we're going to go with. So people have different ways of looking through, but the donors that are selected have undergone rigorous genetic testing, rigorous psychological testing, rigorous medical testing, and clearance. And on a side note, I want to caution my patients: be careful where you get your egg donors from. Um, we certainly believe and subscribe to the fact that people who donate should be doing it out of um, the want to be of help, that they're doing it, it's a choice. If you get eggs from overseas, you really don't know what sort of screening or psychological evaluation was done. And heaven forbid you get eggs from someone who was actually trafficked against their will. And that should be a no no for sure. Um, Once you've selected your donor, there are legal agreements that, both between to protect you, to protect the donor, psychological evaluation for you, for the donor, to see if you're ready. But most importantly, genetic carrier screening. So, if your partner um, is a genetic carrier for, say, sickle cell, then you might not want to pick a donor who's a carrier for, say, sickle cell, because then you have a 25% chance of having an affected child. So all those tests are done ahead of time. Then the next thing is preparing your body, right? How do you know your body is ready to accept the embryo, right? So you could do this concurrently, right, side by side for a fresh transfer, or the donor could go through, you create an embryo, then you prepare your body. Your uterus is evaluated to make sure it's within normal range. You might get an ultrasound evaluation, some sort of evaluation of the cavity to make sure there's nothing that could disrupt the implantation. And usually, preparing the body may be done with your body's own natural cycle, or may be done using medication, hormones that your body normally would produce anyway, such as estrogen and progesterone, in the form of pills or patches or injections to create the lining that will be sustainable for an embryo. So while you're going through this, you're going to be monitored very closely to make sure that your uterus is responding well. Once the donor goes through the process of stimulating her ovaries to retrieve eggs, this is done under anesthesia, sedation. They're not intubated. The partner sperm or donor sperm is used to fertilize the egg, right? And this can be done with just regular IVF, where the sperm is placed on top, or intracytoplasmic insemination. Other options which you don't have to do, because most donors are typically young and therefore have healthy eggs, um, is the option of pre-implantation genetic testing, and that is simply testing the embryo created to see if it has a normal chromosome balance, right? And it enables you to select, or it's supposed to enable you to select the embryo that is most likely to yield in a healthy baby. So that's what that is, pre-implantation genetic testing for aneuploidy or PGTA. Now, what is the transfer process? That usually is a very quick procedure. It's done not under sedation or anesthesia, with a soft catheter going into the uterus, typically under sonographic guidance, to place the embryo into the endometrial cavity. And then afterwards, the pregnancy is supported with hormones as well to support the embryo after transfer. And the pregnancy test is done, anywhere from 9 to 10 days after the transfer is done, right? So if the pregnancy test is positive, congratulations, that's wonderful. We're going to monitor the beta HCG levels, that's the pregnancy hormone, to make sure it continues to rise appropriately. And an initial ultrasound is done within 6 to 7 weeks to see if there's a gestational sac, if there's an embryo or fetal pole, and is there a heartbeat. And typically, you might be monitored to 8 to 10 weeks before you are discharged for obstetrical care, right? So it's kind of a long process. So um, I think final thoughts that I want to leave my patients are um, parenting is what matters, love matters, not really genetics. And I have always told my patients, I don't know that I've ever seen an embryo and a baby, a young child, come back and say, gee, I'm really bothered. Did my DNA come from you? If the child is raised in an environment of love, the desire to create a family is just so you can love your child and express that love in full. So I think it's a very personal, powerful, poignant choice for our patients. And I think choosing donor IVF is really an act of courage. Um, but there are support systems in place, um, to walk with you throughout each step, right? So there's counseling, there are support groups, so you can ask your questions and feel supported throughout this whole process. So what should you do if that's the next step? I think you should schedule an appointment. Give us a call or call your nearest fertility clinic and schedule that initial consultation. Start having um, the talk with them. Understand that your journey is certainly valid. It's a worthy journey, and it's a powerful journey. Congratulations! And again, once more, if you have found this episode to be helpful, please like, share, and subscribe and spread the word. It does help us be able to present more data to our listening audience. Thank you. My name is Dr. Famuyiwa.